So when I'm looking after patients with atrial fibrillation, I tend to divide up the way I look after atrial fibrillation in three different areas. So the first is to understand why somebody might have atrial fibrillation in the first place. So thinking about whether there are any issues with somebody's lifestyle, diet, or whether there might be any underlying issues with the structural function of the heart, which may mean that the patient has atrial fibrillation, and really tackling those head on. The second is looking at somebody's risk of a stroke. So if you are young and have no other medical problems and are otherwise quite fit, your risk of a stroke related to atrial fibrillation is minimal to zero. But if you have issues like type 2 diabetes or high blood pressure, that risk can be quite substantial, and we need to get you on the right medications for that at the earliest possible opportunity. The third is managing the atrial fibrillation in itself, so making sure if you're having intermittent episodes of atrial fibrillation, whether we can minimize those, or if you're in atrial fibrillation all the time, making sure that the heart rate is well controlled and it's not having an impact on the function of the heart. And we do that through a number of ways. So it might be trying to eliminate any triggers for your atrial fibrillation. You'll be getting you on the right medications to try and reduce the episodes. And if you're the right kind of patient for this, an ablation procedure to try and get rid of the atrial fibrillation completely, which can be a very neat solution for many people. So if you are troubled with symptoms for your atrial fibrillation, do come and book in and we can take things forwards.